There's an assumption that people who live alone are lonely, and that's not always true. For some people, that's chosen. So you have to think about that loneliness is something that's distressful. It's different than solitude. Some people desire solitude, and that's okay. Are there still some risks of living alone? Yes, there are. And that if you live alone and you fall, it's a lot harder for you to get help than if there's someone there that's going to hear you, or et cetera. So there are some tangible things. But it's important to know that that's not an automatic risk factor. However, if we go back to the social connection framework and function, structure, and quality, there are people that are married with poor quality relationships, with relationship strain, and that can actually contribute to loneliness.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman.
Not Born Yesterday is brought to you by Next Village SF, a local nonprofit providing older adults in the Northeast neighborhood of San Francisco with support to help age in place. I'm Lynn Winter-Gross.
On May 2nd, 2023, the U.S. Surgeon General, Dr. Vivek Murthy, sounded the alarm about an American epidemic which predated COVID, the phenomenon of loneliness, now affecting half of all Americans. It is a serious problem. But if you don't immediately see the connection to health, both physical and mental, stay tuned, because today on Not Born Yesterday, we will examine loneliness and how it relates to happiness, longevity, and health.
People of any age or background can experience loneliness and isolation, but some groups are at higher risk than others. Older people and those who live alone are on top of the list. Here to discuss the issue of loneliness and its impact is our guest, Dr. Carla Perisonotto. She is professor at the University of California, San Francisco, and is board certified in internal medicine, geriatrics, and palliative medicine. She's internationally recognized for her research on the effects of loneliness on the health of older adults. Welcome to Not Born Yesterday. First of all, doctor, how do you even measure loneliness?
So there's actually many different ways to measure loneliness, but one of the most commonly used scales is something called the UCLA-3. And it asks people three questions. Do you feel left out? Do you feel isolated? Or do you lack companionship? And you're trying to figure out how often someone may feel this way. If it's some of the time to even one of the questions, we would consider someone to be somewhat lonely. And if you're feeling that way all the time to those three questions, that's really the more severe and chronic loneliness.
In preparation for this, I actually read the Surgeon General's report, and it was interesting to notice that he himself had suffered from loneliness. He had been Surgeon General under President Obama and then was let go under President Trump. And he said that what had happened while he was Surgeon General the first time, he sort of didn't have time for his friends. He was so devoted to the job. He excluded. He didn't even reach out and call anyone. And then when he lost his job, his only contacts had been with people that he worked with. He didn't have that anymore. And he didn't know where to turn. And he was very lonely. And he luckily started getting more support from his family. So I just wanted people to know that you don't have to be old. You don't have to be living alone. It can happen to anybody at any time. But let's start with the medical view. Why is loneliness and lack of social connections a health issue? And why should we be worried about it?
Yeah. So it is an incredible health issue, because what we know about people who feel lonely is that it's analogous to having a chronic stress that causes chronic inflammation in our body, and that leads to several health problems. If you think about, or if I can think about, when I see patients in my practice as a geriatrician, what my patients want the most is, how can I maintain my mind or my cognition, and how can I maintain my independence? And loneliness affects all the different health outcomes that go into that. It increases your risk of dementia, particularly Alzheimer's. It increases your risk of functional decline or losing your independence. It increases your risk of diabetes complications, of heart attacks, of all-cause mortality, frailty, you name it, that's where it is. And so it is not insignificant. And what's interesting is in the last few years, actually the last year, there's new data coming out saying that in terms of numbers of people experiencing loneliness, there's actually greater numbers of younger people. Okay. But what happens for the generation that I'm most interested in, which is older adults, is that the health effects are much greater, because as we get older, we may already have some chronic diseases, our physiologic reserve changes. And so our ability to bounce back from an illness is that much greater. So if we're lonely or if we're isolated, our risks of bad things happening are just greater. So that's really why this is talked about at the public health level and as a health issue.
I have a friend who's 96 and she was perfectly physically, mentally healthy, but she's afraid of COVID. And for the last 3 years, she has not gone anywhere, done anything. And I just wonder, what can those people do who don't want to expose themselves to disease, but are nearing the end of their lives? It seems like there's a double negative coming at them. Do this, don't do this. What should they do?
That's a really important question. And that's something I hear a lot these days. And when you actually look by numbers, there are a greater number of people being affected by loneliness right now than there are of COVID. The other thing to think about is what we've seen with vaccines, with the new medications that you can take when you get COVID, or if you get COVID, your risk of death is not what it was in the first round of the virus. So I actually think people are causing more harm to themselves by not connecting with others. And medically, I do recommend to my patients to engage socially. And if I still don't convince them to do in person, then it's thinking about, are there other ways to maintain your connections to your friends, community, in the world, virtually or by phone or by listening to this great program?
Are some groups more at risk than others? Some older adults more at risk of being lonely than others?
There are groups. What we know is that we see some. So I would say two things. In one way, loneliness is agnostic to age and who you are. Any of us are at risk at any time. However, what we do know is that living alone can be a risk factor. It doesn't mean you automatically are lonely because you live alone, but it can be. The loss of spouses. We do believe that there are higher risks among some ethnic groups, so non-white people, or if you're in a minority community. So if you are in a group, let's say you are not a native-born American and don't speak English, and you're in a community that's only English speaking, well, that's going to make you at higher risk. Socioeconomics, unfortunately, make you a slightly higher risk as well. So there are some other risks. And the way I like to think about it is that losses predict loneliness. Loss of job, change of environment, loss of hearing, loss of vision, loss of partners, loss of purpose.
So what are the consequences for society when we lose social connection?
Oh, there's great consequences. And I think, what I appreciated about the Surgeon General's report is that there is this focus on the individual, right? This affects all of us as people, but there's a greater effect in terms of what is happening to our social fabric and how we connect to others. And there's financial implications. There's research looking at financial implications in terms of productivity in the workplace. And there's also estimates saying that isolation costs Medicare more than $6 billion a year because of the health consequences. So you can look at this across the gamut in terms of the overall effects on all of us.
You talk about isolation. I'm thinking of all of the people who are working remotely these days.
That's exactly right. As I sit here in my house and am not able to go to work because I have my husband sick, ironically, with COVID. And so that is a huge thing. And that's one of the things that we're starting to look at in the workplace. And I think as employers, what they're saying is, I know you like being in your pajamas at home, but you're forgetting the importance of connecting socially with others and how important that is to our health and really to our intellectual stimulation, right?
So it's the employers who really need to change the attitude.
That's exactly right. And I think that's why, again, returning to the Surgeon General's report, what I love is from a public health perspective, which he takes, is looking at this across the socio-ecological model, is that all different sectors of our world, employment sector, education sector, healthcare sector, the arts, we all have a role in this. Same thing at the individual, community, county, society level.
So I've read that there's a move on now to have doctors ask their patients if they're lonely. And it sounds very nice, but the doctor's spending, 15 minutes with you if you're lucky. And what does the doctor know? How, you said there are these three elements they should look at, but what is someone to do really? Doctors don't even ask you, how your breathing is these days. So
Yeah.
it's a challenge to make an assessment like this.
It is a challenge. And I will tell you, if I had more than, a couple minutes to talk to you, I would talk more broadly about what's going on with our healthcare system. The fact that we think 15 minutes is enough to talk to an older adult in clinic. I would phrase it in two ways. One, there are things that are built into what we do in medicine that actually are not as important as we think we are. We do a lot of routine things in medicine that don't matter as much to people's health or don't matter to my patients. So in some of my patients, it may be more effective for their health for me to focus on their social connection than checking on their diabetes that's already controlled. It's a little bit of an oversimplification, but I think it's making the point that we're prioritizing the wrong things. We know that there's great data that say that social determinants of health, the social factors in our life, affect our health. So where do we go from here? 3 questions is not a lot of time. And what I teach my physician colleagues or clinician colleagues, it doesn't mean you're going to solve loneliness today, but there are other things that I ask about in healthcare that are not easy to solve. I may ask someone if they're in an abusive relationship. I may ask about smoking. I can't solve that overnight, but it doesn't mean I'm just going to turn my head away and ignore it because I'm uncomfortable with it. So part of my education is teaching clinicians to not shy away. And then over time, you unpack it. What I like about the Surgeon General's report is he breaks down social connection into the drivers. Is it a functional issue? Is it a structural issue? Is it a quality issue? And what I mean by that, so structurally, does someone have people in their lives that they can turn to? And if not, then I'm going to focus on that. The second part is functional. Maybe someone has people in their life, but they're not fulfilling their needs, right? So maybe they do have a partner, but their partner's not able to support them emotionally or in emergency situations. And then it's quality. So maybe they're relationships, but they're just not good relationships. So slowly over time, you can tease that out in the same way that if I'm seeing someone for blood pressure, I may not fix it overnight. Sometimes I can, but it's over time thinking about, well, let's talk about lifestyle modifications. Let's talk about your diet. Let's talk about your exercise. Let's talk about medications. Then I'm going to check your labs. It's a similar thing. We often as physicians, we're a little stubborn and narrow-minded, and we've been trained this way. And so part of it is retraining how we think and not shying away for difficult topics.
I was thinking if a doctor doesn't bring it up, how can I as a patient bring it up? But I don't think I would just say to the doctor while he's doing my blood pressure, maybe I'm a little lonely.
Well, I have actually had patients bring it up to me that way. And I think part of this conversation is starting to get comfortable with that idea of is reducing the stigma so that it is normal in the same way that you might say, well, I'm feeling a little bit depressed or I'm feeling a little bit anxious. So it's trying to make both, like educate the public to advocate for ourselves, and educating the healthcare community and coming somewhere in the middle. An informal study I did in a continuing care community, I asked the participants in the audience, how often have you been asked and how often do you bring it up? And it was about 50%, more than I expected, but some. And so I think that, we've come a long way, but we have more to go.
One of the things I wanted to mention is that this podcast is sponsored in part by one of the village movements called Next Village, and
Right.
groups like that promote all sorts of social activities so people can connect with other people locally in that way.
That's exactly right. And those are the really awesome creative solutions we're seeing out there that are effective. So how do we expand those? How do we normalize those? And again, how do we include all of us, regardless of age, into activities and make the built environment supportive of social connection?
On the podcast, we continually encourage our listeners to volunteer, to get involved with their communities and stay connected. And the Surgeon General's report, says the same thing. But is there anything that public policy or our city governments can do to encourage this and make it easier to connect?
There's a lot that can be done. So there's different levels, but to give you some examples, I think the built environment, literally in terms of how we build our city spaces, in terms of having places outside in the infrastructure to support connection. That's on a very simple level. The other ways that we can work on this from a policy level is thinking about for people that can't get out or to promote connections for people that are separated by geography is broadband access and making them decreasing the social and economic inequalities between those that have internet access and those that don't. The other parts I do think that the policy has a work in is thinking about measurement and how we measure loneliness and isolation and how do we include it into our everyday world and healthcare so that it becomes a standard thing.
Well, we always try to give our listeners an action plan, when we cover different subjects. And according to the Surgeon General's report, there are some things you can do to help the socially isolated. They said answer a phone call from a friend, invite someone over to share a meal, listen and be present during conversation, and seek out opportunities to serve others. Do you agree that these help? And is there more that we can do?
I agree that those help. And I think that there's more that we can do. And there's actually more research that we need to do. There's some things that are very common sense to do in terms of picking up the phone and, calling my mom or calling my neighbor. But some of the more detailed interventions, we need more research, because if we have the research to support it, then hopefully then there's more payment and reimbursement and support for these programs at a policy level. But I think more specifically, it's important for us to think as individuals, what is driving my own personal loneliness, right? So to give you an example, to say what that would look like, during the pandemic, when I was pregnant, I was very lonely and I didn't realize it. And part of it was that I was so immersed in work and trying to prepare for this child coming that I wasn't connecting with my friends. And so it takes some look internally about, why am I doing that? What is my fear? What is my hesitancy? It's being intentional. So it's trying to figure out what is driving yours. For some, it may be, I'm embarrassed about my hearing loss and I'm not dealing with it. But suddenly, I actually just had an amazing experience with a resident living in a nursing home in Texas that we were trying to connect him with some students for companionship, and his hearing was terrible. Once we gave him a hearing aid or a hearing device, that opened up his world. So sometimes there's these, much more obvious solutions, but it takes a little bit of creativity to think through it.
I wanted to go back to something you just said before about more broadband, because again, in the report, there was trying not to be political, but there was a message that staying on social media has an effect on people in terms of their politics.
Yep.
They keep hearing negative messages, whatever it is, over and over again. And if that's all the person is getting, that sounds very dangerous.
It is very dangerous, and it's a slippery slope. And I would say what the data shows in terms of just technology use, not just social media, it's how we're using it and why. So if we are using it, if I am on my phone and on TikTok or whatever, instead of hanging out with my friends, that is not good. Okay. If I'm using it as a way to connect to others because I'm home and I can't get out of my house, or my mother lives far away, then that can be a positive thing. It is not the same as in person, because the research has shown that in person is always superior to the other modalities. So it's how we use it and why.
I wanted to throw in one more thing. You had mentioned that just living alone isn't the only way people become lonely. People who are married can become lonely, but we don't normally think of it that way. Like, oh, they're married, they're fine. What do you have to say about that?
I think that's really important. So there's an assumption that people live alone are lonely, and that's not always true. For some people, that's chosen. So you have to think about that loneliness is something that's distressful. It's different than solitude. Some people desire solitude, and that's okay. Are there still some risks of living alone? Yes, there are. And that if you live alone and you fall, it's a lot harder for you to get help than if there's someone there that's going to hear you, or et cetera. So there are some tangible things, but it's important to know that that's not an automatic risk factor. And similarly with people that are relationships, it's not a guarantee that that's going to be, that you're not going to be lonely. Is there some evidence that says that a relationship is protective? Yes. However, if we go back to the social connection framework and function, structure, and quality, there are people that are married with poor quality relationships, with relationship strain, and that can actually contribute to loneliness.
Are there any other things you want to add that we've missed about what people should do if they think they're feeling lonely, or that this is an issue that they've confronted and don't know what to do about?
I think my main points are to be honest with yourself about what's driving it, and some of that can be really hard. But don't take it all on yourself, meaning it's not your fault. So don't lose hope and prioritize it. The second half of our lives is really and should be about quality of life, and how can we do that? And I firmly believe that connecting is a big part of that.
Well, thank you. So that there is hope for all of us. And I want to thank you so much for talking to us about this important subject. Our guest is Dr. Carla Perisonotto of the University of California.
Thank you so much.
Today on News You Can Use, we're talking about the term gray divorce and the one that comes after that, gray remarriage, the term for couples who are divorcing after many years of marriage. This phenomenon has many people wondering why these numbers are growing. Some say the pandemic and retirement forced couples into too much togetherness, and they realize that they've grown apart. Others are saying that now that women have their own money and settlements and divorces are more equal, couples no longer have to stay together for financial reasons. Whatever theory you believe, gray divorce also means a growing number of gray marriages. Many divorce boomers are remarrying and finding new hope in relationships that will ideally last for the rest of their lives. But the reality is that second marriages also have a high divorce rate, and many couples enter into late marriage without understanding that new marriages bring new issues and, for some, new problems.
Of course, there are problems related to money. Often a problem in any marriage is money, but especially when two people who have their own money come together, there may be a clash of spending and saving styles. For example, let's say she moves into his house. Who gets the house when the owner dies? If he kept it in his name and he dies first, the will may provide that his children inherit the house. If the house is in both of their names and she dies first, what are the rights of her children? These are matters that must be spelled out at the beginning. Then there's that awkward moment of the prenuptial agreement. Women entering second marriages are often reluctant to ask for one. But assuming you both are bringing some assets into the marriage, this is important. If you don't have such an agreement in writing, the surviving spouse often inherits the bulk of the estate. That's fine if that's what you both want. But again, if there are surviving children from either marriage, it can be awkward. If you're already in a second marriage and don't have a prenup, ask an attorney for a postnup. That way, the lawyer can bring up the awkward questions that neither of the partners want to be the first to mention.
Which brings us to beneficiaries. If you're entering a second or third or fourth marriage and have life insurance, retirement plans, pensions, and other assets, don't forget to change your beneficiaries. Do you want your assets to go to your new spouse, your kids, or even a charity? Your ex-spouse may be out of the picture in your life, but if you forgot to take him or her off the assigned beneficiary list when you divorce, this takes precedence over a will. This applies to your investments in the stock market, IRAs, and anything else that asked you to name a beneficiary when you opened the account. Take care of these things now by updating those financial records. And don't put off the conversation about money when you plan to remarry. Each partner should know the other person's financial status, whether one is co-signed for his or her children's college or home loans and are paying for grandchildren's summer camp, or have charitable funds you continually contribute to. If you plan to commingle all your accounts, realize you both will be revealing how much you spend on haircuts or maintaining that sailboat. In all marriages, honesty is the best policy, but a separate checking or credit card account may help avoid some difficult conversations about spending styles.
And that's our podcast for today. Our thanks to our guest, Dr. Carla Perisonotto. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstedt is our engineer. And thank you for listening. We'd love to hear what you'd like us to discover and discuss. Please contact us at notbornyesterdaypodcast.org and follow us on Facebook. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.